Good afternoon, student. Today we will learn about the pathological fracture. In the yesterday's lecture, we will learn about the fractures in the special situation. Second is epiphyseal injury, and now we will learn about the pathological fractures. So, pathological fracture is occur when a fracture occurs through a bone which has already been weakened by a generalized or localized skeletal disorder. It is called as a pathological fracture. So, when there is a already weakened patient due to some generalized or localized skeletal disorder, it leads to the fracture of the bone, which is called as a pathological fracture. Unlike the traumatic fractures, these fractures take place either spontaneously or due to the trivial trauma. A quick glance at the causes of the pathological fracture. So the causes of pathological fracture are firstly the localized diseases, that is infective disorders, in that chronic pyogenic osteomyelitis, tubercular or syphilitic osteomyelitis, neoplasm. Then in benign there is a chondroma and giant cell tumor, hemangioma of spine, lung, breast, prostate, kidney, etc. And bone atrophy, for example, in a polio, tabes dorsalis, etc. And in the malignant, there is a osteogenic sarcoma, Ewing's sarcoma, solitary myeloma, metastatic carcinoma, metastatic sarcoma. They see that is a miscellaneous cause. Simple bone cyst, then monostotic fibrous dysplasia, eosinophilic granuloma, and in the general affection of the bone, there is a congenital disorders like osteogenesis imperfecta, fibrous dysplasia, Gaucher's disease, etc. And in the B, that is generalized refraction of bone, in that there is a senile osteoporosis and hyperparathyroidism, osteomalacia, nutritional rickets, and scurvy. And EC, that is miscellaneous, indeed there is a multiple mycelia, diffuse metastatic carcinoma, D, that is disseminated tumors, in that Paget disease, fibrosis dysplasia, and Gaucher disease. So, the common site for pathological fractures are follows, that is, firstly, a neck of the femur, then B, that is, neck of the humerus, C, that is, the distal end of the radius, D, that is, the compression fracture of vertebra, and E, that is, the fracture of the hips. Then the clinical picture shows that the patient usually complain of fracture following a trivial trauma. Firstly, there is a some trivial trauma which lead to the fracture. He or she complain of having suffered pain or discomfort in the region of the affected bone sometimes before the fracture. So, the underlying cause of this could be either a generalized disorder or local skeletal disorder. In that, practical points are common causes for pathological fractures, Firstly, the local disorders, in that metastatic carcinoma. In these, the primary could be in the lungs, breast, prostate, thyroid, or kidney. The common sites are the vertebral bodies, that is, in the thoracic and lumbar regions, proximal half of the femoral shaft, then proximal half of the humerus, B, that is bone cyst of a long bone. Generalized disorders are A, that is senile osteoporosis. These are the common sites of the affected are in the senile osteoporosis is thoracic or lumbar vertebral body. In that neck or trochanteric region of femur. B, that is Paget's disease of bone. In that shaft of the tibia or femur. Then investigations are firstly the lab investigation. These include HBS, TG, DG, ESR, serum calcium, phosphate, alkaline and acid phosphatase, etc. Plain X-ray of the affected bone including the joint above and below. CT scan and MRI are of extreme importance to determine the extent of pathological involvement. Bone scan is helpful in determining the spread of disease. So, for the lab investigation, blood investigation, X-ray, CT scan, MRI and bone scan give the important information about the pathological fractures. Then the treatment is firstly the conservative treatment has a little role in the treatment of pathological fracture. The treatment which is recommended is open reduction, rigid external fixation with or without cement and bone grafting. So, in the pathological fracture, the conservative treatment have the aim is to obtain quick union and mobilize the patient early. Pathological fracture is due to the Paget disease, osteogenesis imperfecta, etc., which is unite in the usual time. Fractures due to the osteomyelitis, bone cyst unite late, but fractures due to the malignancy, metastasis due to do not unite at all through union is possible after chemotherapy or radiotherapy. So, do you know the most common causes of pathological fractures are firstly the osteoporosis first and metastasis into the bone next. So, the common causes of pathological fracture are osteoporosis and metastasis. Then next is a fatigue or stress fracture. So, in the pathological fracture, we was learn that its definition, causes, then common sites of pathological fractures, that is femur neck, neck of the humerus, distal end of the radius, compression fracture of vertebra, and fracture of ribs, and its clinical features with investigations and treatment. So, for the Pathological fracture. The aim is to obtain a quick union and mobilize the patient early. Pathological fracture due to the Paget disease, osteogenesis imperfecta, etc. Unite in the usual type. Fractures due to the osteomyelitis, bone cyst, unite late, but fractures due to the malignancy, metastasis do not unite at all through the union is possible after chemotherapy or radiotherapy. So, the most common causes of pathological fracture are osteoporosis first and the metastasis into the bone is the next. Then, fracture or stress fracture. Fatigue or stress fracture. Fatigue or stress fracture, defined as it occurs mainly in the normal bones due to the repeated stress or minor trauma to a particular bone, usually of the lower limb. It is more common in metatarsal bone and is known as the March fracture. So, when fatigue and stress fracture is occurred, it is mainly seen in a normal bones. So, it is due to the repeated stress or minor trauma to a particular bone, usually at the lower limb, and it is more common in metatarsal bone. It is known as the March fracture. Then the clinical features are here there is no single specific causative injury as in traumatic fracture. Okay. Here there is no single specific causative injury as in a traumatic fracture. The onset of pain is gradual and or insidious. Activity increases the pain and rest relieves it. On examination, there is a significant local tenderness and thickening of the bone, local swelling. So, when there is a fatigue or stress fracture is occurred, why it occurs? It occurs due to the repeated stress or the minor trauma to a particular bone, usually of the lower limb. So, it is more common in metatarsal bone and is known as a March fracture. And clinical fracture features are that there is a no single specific causative injury, but the onset of the pain is gradual or insidious, and activity increases the pain and rest relieves it. So, on examination, there is significant local tenderness and thickening of the bone. So, there is a local swelling. Vital facts are stress fracture, who are prone for the stress fracture. In that, firstly, athlete, dancers, doctor, nurses, policemen, soldiers, sports persons, surgeons, and unknown group. So, stress fracture, who are prone for this, that athlete, dancer, doctor, nurses, policemen, soldiers, sports persons, surgeons, and some unknown group are prone for the stress fracture. Then radiograph. Radiograph of the part at first may not reveal any fracture but may be seen after 3 to 4 weeks. The fracture itself may be hairline, transverse or undisplaced. More striking than the fracture is a zone of callus that surround it. So in the radiograph of the part first may not reveal any fracture but may be seen after 3 to 4 weeks. The fracture itself is hairline, transverse and undisplaced. So there is a more striking than the fracture is the zone of callus that surround it. So this is a diagram of a stress fracture of third metatarsal bone, that is diagram A. In that we can see that how the stress fracture is occur at the third metatarsal of the bone. And this is a radiograph showing the stress fracture of the ischium. So these are the examples of the stress fracture. Then bone scan. This is of great help in determining the presence of stress fracture. MRI and CT scan. There are the other useful investigations but are expensive. Treatment shows that stress fracture usually heal by rest and support to the affected part. So practical point is that stress fractures, the common sites are second and third metatarsal bone, that is march fracture due to the repeated marching as in shoulders, tibia or fibula that is repeated due to the running or dancing, femur fracture it is occasionally. So these are the stress fracture point, that is common sites are second third metatarsal bone in march fracture. So it is seen in the soldiers due to the repeated marching, and tibia fibula fracture is due to the repeated running or dancing, and femur fracture is seen occasionally. So radiologically in the first week, usually there is a no fracture is detected. And in the second and third week, there is a faint hairline fracture, transverse and or undisplaced. Zones of callus that surround the fracture is more significant than the fracture itself. So treatment is by the test. So when radiologically we diagnose or investigate the fracture, in the first week there is a fracture is not detected. In the second or third week there is a faint hairline fracture, transverse or undisplaced. But the zone of the callus that surround the fracture is more significant than the fracture itself. So treatment is the rest and is the more important. Then this is all about the fatigue or stress fracture. So when we learn about the fractures in the special situations, we learn in this chapter that epiphyseal injury, pathological fractures and the fatigue or stress fracture. So in the fatigue or stress fracture, its definition, clinical features, vital facts, radiography, then its examples, that is stress fracture of third metatarsal bone, and radiograph which are showing the stress fracture of ischium and its treatment, practical points that are the common site of the fracture. Then, then the next topic in orthopedic, that is the regional traumatology. Regional traumatology is also an important chapter in orthopedic which gives detail about the injuries around the shoulder, then injuries of the arm, injuries around the elbow, injuries of the forearm, injuries to the wrist, hand injuries, then dislocation and fracture dislocation of the hip joint, fracture femur, injuries of the knee, fracture of tibia and fibula, injury of the ankle, injuries of the foot, pelvic injuries, rib and coccyx injuries, and injuries of the spine and peripheral nerve injuries. So, this is these points are discussed in this regional traumatology. So, firstly, when we say the injuries around the shoulder, the following points are included in this topic. That is, firstly, the introduction, then the fracture clavicle, injuries to the acromioclavicular joint, injuries of sternoclavicular joint, proximal humeral fracture, dislocation of shoulder, anterior dislocation of shoulder, recurrent anterior dislocation of the shoulder, and fracture of the scapula. So, when we will learn about the introduction of this topic, that is injuries around the shoulder, it described as the shoulder joint is a complex and consists of the glenohumeral joint, the acromioclavicular joint, and sternoclavicular joint. The injuries concern all the three joints and the fractures involving the clavicle, scapula, and the proximal humerus are discussed here. So, so shoulder joint fracture is consists of the fracture of glenohumeral, that is humerus and the glenoid cavity, and acromioclavicular, that is acromial process and the clavicle, and sternoclavicular is sternum and clavicle. Joint, all the three joint is present or involving the fractures associated with the shoulder joint. Firstly, in that we will learn about the fracture clavicle. The term clavicle is derived from the Latin root, that is clavis, meaning key. Clavicle is S-shaped and is linked to the music, that is symbol clavicula, and hence the name. The clavicle is the first bone to ossify in the body. It ossifies from the two primary centers. It is the only long bone in the body which is lying horizontally. Then clavicle is the only long bone which is ossifying from a membrane. Clavicle is the only link between appendicular and axial skeleton, and it is the most common bone to be fractured in children. So it is invariably end up maluniting after the fracture. So this is a bony anatomy of the clavicle, which shows that this is the lateral end, this is the medial end of the clavicle, and this one is the anterior border, and this is the posterior border, and this is the shaft. That you was learned in a anatomy. That is lateral and medial end, anterior and posterior border, and the shaft. Then the functions of clavicle are: it increases the arm strength mechanism, then it protects the neurovascular bundle consisting of subclavian vessels and brachial plexus. It gives attachment to important muscles around the shoulder. It braces the shoulder back during rest and motion, that is trapped function. And the mechanism of injury are, so these are the function of the clavicle, that it increases the arm strength mechanism. It protects the neurovascular bundle consisting of subclavian vessel and brachial plexus, and it gives attachment to the important muscles around the shoulder, and it braces the shoulder back during the rest and motion. Then mechanism of injury shows that direct is due to fall of the point of shoulder. This is the most common mode of the injury, accounting for 91% of the cases. And in the direct trauma over the clavicle, that is due to the RTA, road traffic accident, direct injuries, etc., which account for 8% of the cases. For example, recklessness like this can break your clavicle bone due to bone injury, due to direct injury. An indirect fall on the outstretched hand account for 1% of the cases. So the mechanism of injury shows that direct, that is due to fall on the point of the shoulder. So in this diagram we can see how there is a direct injury to the shoulder. This is the most common mode of the injury, accounting for 91% of the cases. And direct trauma over the clavicle is due to the RTA direct injury, for account 8% of the cases. So this is a diagram of the recklessness, like this can break your clavicle due to the direct injury. An indirect fall on the ostrich hand account for 1% of the cases. Then the site of the fractures. Sites of the fracture shows that 85% of fracture clavicle occur at the junction of the middle and outer third. So diagram showing the various displacing forces in fracture clavicle. In that, 1% at the medial end of the clavicle, that is of 5%, that is this at the medial end of the clavicle, that's here. Then lateral end of the fracture is uncommon, it is about 10%, that is about the distal one third. So in this diagram you can see this is the sternomastoid muscle, this is the pectoralis major muscle, and here is a fracture of the clavicle in the medial end. At the center of the clavicle is fracture. So weight of the arm against the gravity. Classification of fracture clavicle, that is by the Almond, is that in group 1 is the fracture involving the middle one third of the shaft. When the fracture in the middle one third of the shaft, then this is called as a group 1 fracture. And group 2 fracture is the fracture involving the lateral third distal to the attachment of the coracoclavicular ligament. So group 2 involve when there is a lateral third distal to the attachment of coracoclavicular ligament, this is further subdivided into the two groups, which is proposed by Mir. In that, type 1 is the coracoclavicular ligament intact. Then type 2, when coracoclavicular ligament is ruptured. And type C, when intra-articular extension into the acromioclavicular joint. And in group 3 are medial third of the fracture. So, classification of fracture clavicle include the three groups, in which in the group 1 there is the middle one third of the shaft of fracture, and in group 2, which involve the lateral third and distal to the attachment of coracoclavicular ligament, then 3 are medial third fractures, and group 2 is again subdivided into A, B, C. That is, in A, coracoclavicular ligament is intact. In B, coracoclavicular ligament is ruptured. And in C, where the intra-articular extension into the ACM joint. Then the clinical features are the patient present with the pain, swelling, deformity, and inability to raise the shoulder. Rarely, the patient may present with pseudo-paralysis of the affected arm. Radiograph shows the following views are recommended in that diagram, that is routine anteroposterior view of the clavicle, then lordotic view if the fracture is doubtful, and distal clavicle require a special radiography technique. So principle of treatment is that before proceeding to the treatment proper, one need to understand the two distracting forces acting on the fracture fragment in the clavicle, making the treatment difficult. The sternocleidomastoid muscle pull up the medial end of the clavicle, and the pectoralis major muscle and gravity acting through the arm pull down the lateral end. So, in that, there is the pain, swelling, and deformity with inability to raise the shoulder. So, rarely the patient may present with pseudo paralysis of the affected arm. And in the X-ray, that is in the radiograph, we shows that there is a routine anteroposterior view of the clavicle. In that, we can easily see the fracture of the clavicle, and lordotic view if the fracture is doubtful. Then distal clavicle require a special radiography technique. So principle of treatment is that before proceeding to the treatment properly, one need to understand the two distracting forces acting on the fracture fragment in the clavicle, making the treatment difficult. And the sternocleidomastoid muscle pull up the medial end of the clavicle. That is, we see in here that the sternocleidomastoid pull the clavicle end to the medial end, and the pectoralis major muscle and gravity acting through the arm pull down the lateral one. So in this diagram we can see pectoralis major muscle and the gravity pull the arm below or to the lateral end. Then to counter the above two detrimental forces, the shoulder should be braced up and back and the arm should be supported vibrating the fracture clavicle. So fracture clavicle required a support. That is, a conservative method shows when this is the treatment of choice of fracture clavicle and consists of the following method. That is, this is a diagram which shows the conservative method of the fracture of clavicle. In that, there is first is a collar and cuff sling. So this is a collar and cuff sling which act as a conservative method of fracture of clavicle. Then B, that is strapping and sling suspension. So here is the strapping and sling suspension is given. Then C, that is figure of 8 bandaging and collar sling for undisplaced fracture. So when there is an undisplaced fracture is required collar sling or and a figure of 8 bandage. Then a method of the internal fixations in that there is a intramedullary fixation with KY and rigid plate and screw fixation of AO semitubular or pelvic reconstruction plate. So the diagram shows that radiograph is showing the fracture clavicle plate fixation. So in this diagram, there is a fracture clavicle plate. Its fixation is seen. Then the indications are in the open fractures, injury to neurovascular bundles, and if the